Seizure. A seizure is a sudden, uncontrolled electrical disturbance in the brain that can cause changes in behavior, consciousness, movements, or sensation. Seizures can vary in intensity and duration and may result from various underlying causes. Pathophysiology of seizures. Seizures occur due to abnormal electrical activity in the brain. Normally, brain cells communicate with each other through electrical signals. During a seizure, there is an abnormal, excessive discharge of electrical activity that can disrupt normal brain function. This can lead to a wide range of symptoms, including convulsions, loss of consciousness, altered sensations, or unusual behaviors. The exact cause of seizures can vary, but common factors include epilepsy, a neurological disorder characterized by recurrent seizures, brain injuries, infections, metabolic imbalances, and more. Abnormalities in the brain's neurons or neurotransmitters can also play a role. Drugs used to treat seizures, anti-epileptic drugs, or anticonvulsants. There are various drugs used to treat seizures, and the choice of medication depends on the specific type of seizure and the individual's medical history. Some commonly prescribed anti-epileptic drugs, AEDs, include phenytoin, used for treating various types of seizures. Carbamazepine, effective for focal, partial seizures. Valproic acid, sodium valproate, used for a wide range of seizure types. Lamotrigine, effective for focal seizures and some generalized seizures. Levetiracetam, broad-spectrum AED used for various seizure types. Topiramate, can be used for focal and generalized seizures. Gabapentin, often used as an adjunct for partial seizures. Pregabalin, used for partial seizures and neuropathic pain. Oxcarbazepine, effective for focal seizures. Lacosamide, used for partial seizures. These medications work in various ways to control or reduce abnormal electrical activity in the brain and help prevent seizures. The choice of drug and dosage will be determined by a healthcare provider based on the specific diagnosis and individual patient factors. It's essential for individuals with seizures to work closely with a healthcare provider to manage their condition effectively, as treatment may require ongoing adjustments to find the most suitable medication and dosage. Additionally, lifestyle modifications and other therapies may complement medication and seizure management. User. Anticonvulsants drugs and their mode of action. These drugs have various mechanisms of action, but their primary goal is to stabilize and regulate the electrical activity in the brain to reduce the likelihood of seizures. Here are some common anticonvulsant drugs and their modes of action. Phenytoin. Phenytoin works by blocking sodium channels in neurons, which helps to limit the excessive firing of neurons during a seizure. This stabilizes the neuronal membrane and reduces the likelihood of seizure activity. Carbamazepine. Similar to phenytoin, carbamazepine also inhibits sodium channels in neurons. By doing so, it reduces neuronal excitability and helps prevent seizures. Lamotrigine. Lamotrigine primarily inhibits the release of glutamate, an excitatory neurotransmitter in the brain. By doing so, it reduces neuronal excitability and helps control seizures. This reduces the release of excitatory neurotransmitters like glutamate and helps prevent seizures. These actions collectively reduce neuronal excitability. Gabapentin. Gabapentin is structurally related to GABA but does not directly affect GABA receptors. It appears to modulate the release of certain neurotransmitters in the brain, including glutamate and norepinephrine, which can reduce neuronal excitability. Pregabalin. Similar to gabapentin, pregabalin is thought to modulate neurotransmitter release, but its exact mechanism of action is not fully understood. It primarily affects the release of glutamate and norepinephrine. Oxcarbazepine. Oxcarbazepine is closely related to carbamazepine and also inhibits sodium channels in neurons, reducing their excitability. Lacosamide. Lacosamide selectively enhances the slow inactivation of voltage-gated sodium channels in neurons, reducing excessive neuronal firing and stabilizing the neuronal membrane. Each of these anticonvulsant drugs has a specific mode of action that helps to control seizures by regulating the electrical activity in the brain. The choice of medication and its suitability for an individual depends on the type of seizures, the patient's medical history, and potential side effects, and is determined by a healthcare provider.